consisting of the following three components: nutrition therapy, a physical a physical exercise program, and a behavior modification plan. These three components are also the key element for the long-term maintenance of weight loss. Additional methods of treatment for obesity include prescription weight loss medication and bariatric surgery. Studies that even a modest loss of weight results in improved health and the prevention of problems associated with obesity.
All right, very good. So you guys are going to want to highlight the first sentence on that first paragraph. Alexis, I just sent you a message. All right, very good. Let's see. Natalie, will you please go ahead and read the next paragraph?
Uh, it should be emphasized that it is important for an individual to consult with his or her provider before beginning treatment for obesity. Primary care providers often manage individuals with class 1 obesity and class 2 obesity, but patients with class 3 obesity are usually referred to a bariatric specialist. Bariatrics is the branch of medicine that deals with the treatment and control of obesity and diseases associated with obesity.
All right, very good. Thank you. Okay, so I kind of spoke a little this morning as far as bariatrics. So most providers, they may decline treating the diet part with some patients. They're going to refer them to either a dietitian or to a bariatric specialist for treatment options. Now, if you are working with a provider that does want to treat these patients, then this is something that you may, as well want to make sure that you're, kind of study on. So there's different methods for treating obesity. The main part is figuring out the cause of obesity, and it could be a numerous cause. It could be emotional stress, physical stress, genetics, diet, exercise, and even then, if you have the patient do everything, there are some patients that the weight just doesn't come off. And in most cases, with some of the class levels of obesity, it could be a life or death situation, right? Which means if they stay on the path they're on, the health issues that it's causing them is going to it's going to get worse. So we want to try to help these patients as much as possible. So it's going to be more up to your provider if they treat these patients or not. But like with everything else, even if your provider doesn't treat it, then you still are going to want to make sure you have the basic knowledge of it. Okay, so let's start reading by the nutrition therapy. Nutrition therapy for obesity involves the selection of an appropriate eating plan for weight loss. It is essential the eating plan selected ensure an adequate intake of nutrients. The MyPlate Nutrition Guide and the 2015 Dietary Guidelines for Americans, previously discussed in this chapter, provide valuable recommendations for a healthy and balanced eating plan. Okay, let's see. Anna, can you go ahead and read that next paragraph, please?
Oh, I'm just only here to listen. I am driving.
Are you driving too? Okay, that's fine. Jasmine, can you read that next paragraph?
What page are we on? I'm confused. I'm
We're
sorry.
on page 760.
Okay, you want me to read nutrition therapy?
No, I want you to read on the where it says before beginning a weight reduction program on the next.
Oh, okay. Before beginning the weight reduction program, it is important for first set reasonable and safe weight loss goals. Most weight loss authorities recommend a slow, steady weight loss of no more than 1 to 2 pounds per week. This is accomplished by a moderate reduction in the total number of calories consumed to create what is known a caloric
Caloric.
deficit. A calorie deficit occurs when more calories are used for energy by the body, calories out, than are consumed, calories in, resulting in the burning of body fat, which heads to a loss of weight.
very good. Thank you. Okay, you ladies are going to highlight where it says this is accomplished by a moderate reduction in the total number of calories consumed to create what is known as a or a caloric deficient. All right, very good. Nancy, can you go ahead and read the next paragraph, please?
To completely understand the concept of a caloric deficit, it is important to have a knowledge of the relationship between calories and body. 1 pound of body fat is equal to 3,500 kilocalories. Therefore, a decrease of 500 kilocalories each day typically results in a loss of 1 pound each week. 500 times 7 equals 3,500 kilocalories or 1 pound. A decrease of 1,000 kilocalories each day is needed to lose about 2 pounds each week. 1,000 times 7 equals 7,000 kilocalories or 2 pounds. The total number of kilocalories consumed each day, however, should not fall below 1,200 kilocalories to ensure an individual is obtaining all the required nutrients. Most women lose weight safely on an eating plan consisting of 1,200 to 1,500 kcal days, and most men lose weight safely by consuming 15 to 1,800 kcal a day.
All right, very good. So you're going to want to highlight where it says 1 pound of body fat is equal to 3,500 kilocalories. Okay, so, I don't know if you've ever heard, but it's like some people say, oh, well, it's okay to lose a lot of weight super fast. Not in all cases, right? Because that means that we're not putting enough into our body to help keep the nutrients that our body needs to stay healthy while we're losing the weight. So for some patients, they can't lose weight too fast, okay? Because then it will cause other problems. And that's what this is kind of discussing a little bit. All right, very good. Natalie, can you go ahead and read the next paragraph, please?
Numerous weight loss programs are available to assist individuals in achieving their weight loss goals. Examples include the dietary approaches to stop hypertension, include the hypertension eating plan. Weight Watchers, Jenny Craig, and the Mayo Clinic Diet. When choosing a weight loss program, it is important for individuals to choose a program that is medically proven and is best suited to their particular needs and lifestyle. Fad diets should be avoided because they can be harmful to health and do not typically result in good-looking long-term results. Examples include the grapefruit diet, the cabbage soup diet, and the Scarsdale diet. Characteristics of fad diets typically include no exercise, a promise of quick and easy weight loss, a guarantee of a large amount of weight loss, and the elimination of one or more food groups.
All right, very good. So you're going to want to highlight where fad diets should be avoided because they can be harmful to health and do not typically result in good long-term results. All right, so physical exercise program. Anna, can you go ahead and read the first paragraph, please?
I just got home. I don't have my book yet.
Okay, all right, that's fine. Sorry, guys, some of this I'm forgetting which one's driving and which one's not. Jasmine, are you where you can read?
Yes, ma'am.
Thank you.
Just the first paragraph?
Yes, ma'am.
Okay. Physical exercise plays a key role in the treatment of obesity. Exercise increases the number of calories that body burns for energy, calories out, contributing to a caloric deficit and loss of weight. Physical exercise offers additional benefits such as increased lean body mass, improved cardiorespiratory functioning, and an improved quality of life and general well-being. Studies show that individuals who exercise are also less likely to regain their weight after having lost it.
Very good, thank you. Nancy, are you where you can read the next paragraph, dear?
Yes, ma'am.
Thank you.
The AHA recommends that healthy adults spend at least 150 minutes per week in a moderate intensity physical exercise. The AHA further recommends that the adults perform muscle strengthening activities at least 2 days per week. Refer to the patient teaching box, aerobic exercise, in Chapter 4 for more thorough discussion of physical exercise recommendations for adults.
Very good. Okay, so you're just going to highlight the first sentence on that paragraph. Behavior modification plan. A behavior modification plan is an important component in the treatment of obesity. The purpose of such a plan is to assist individuals in changing behaviors that have contributed to their weight gain. An individual must first identify their behaviors that have contributed to his or her weight gain. Examples include eating too fast, eating when not hungry, using food as a reward, eating while standing or watching television, and eating to relieve stress or boredom. Once an individual identifies these behaviors, he or she can take the steps to replace these unhealthy behaviors with behaviors that encourage weight loss, such as chewing food more slowly, keeping tempting foods out of the house, using non-food incentives as a reward, eating only while sitting at a table, and using techniques other than food to relieve stress and boredom. Cardiovascular disease. The leading cause of death in the United States is cardiovascular disease. The most common cause of cardiovascular disease is arteriosclerosis of the coronary arteries. As previously described, arteriosclerosis of the coronary arteries is a condition in which fibrous plaques of fatty deposits and cholesterol build up on the inner walls of the coronary arteries. This causes narrowing and partial blockage of the lumen of the arteries, hardening of the arterial wall, leading to coronary artery disease, CAD. Okay, highlight the word arteriosclerosis and highlight that this causes narrowing and partial blockage of the lumen of these arteries, along with hardening of the arterial wall, leading to coronary artery disease. As the arteriosclerosis progresses, the coronary arteries become more occluded, which eventually could lead to a heart attack. Research has shown beyond doubt that high total blood cholesterol is a major risk factor for CAD, and the higher the cholesterol, the greater the risk. The National Cholesterol Education Program, the NCEP, was established in 1985 by the federal government to reduce the prevalence of elevated blood cholesterol levels in the United States by educating the public about the health risk associated with high blood cholesterol and to make recommendations for helping individuals reduce their cholesterol levels. It has been shown that for every 1% that an individual lowers his or her total blood cholesterol, the risk of CAD is reduced by 2%. The NCEP recommendations are published as a set of guidelines known as the Therapeutic Lifestyle Changes TLC Eating Plan. The TLC plan provides numerous recommendations for a heart-healthy diet, which is presented in Table 21.9 and is described in more detail in the following section. Nutrition Therapy TLC Eating Plan. Nutrition therapy is the first line of treatment for high blood cholesterol. The TLC Eating Plan recommends that all individuals older than 2 years reduce dietary cholesterol and saturated fats and increase their dietary fiber. Refer to Table 21.9. Many foods, in fact, tend to be high in cholesterol. Nutrition labels on packaged products provide information on the cholesterol, fat, and fiber content of the food. Following the nutrition therapy measures discussed later can help individuals reduce their level of bad LDL cholesterol and increase their level of good, the HDL cholesterol. Okay, so let's take a look at the table 21.9. So we have our nutrient and we have the daily recommendation, the recommended intake. I want you ladies to highlight the words saturated fat, dietary fiber, and cholesterol. For saturated fat, highlight where it says less than 7%. For dietary fiber, highlight 20 to 30 grams a day. And for cholesterol, highlight less than 200 milligrams a day. For dietary cholesterol, the body manufactures all the cholesterol it needs for normal functioning, and dietary intake of cholesterol in foods serves only to increase the blood cholesterol. According to the TLC plan, dietary cholesterol should be limited to less than 200 milligrams each day. Cholesterol is found only in animal foods and shellfish. Highlight egg yolks, dairy products, and organ meats such as liver and kidneys are especially high in cholesterol. Natalie, will you please read saturated fat?
The intake of saturated fat is the most important dietary factor leading to high blood cholesterol, even more than consuming dietary cholesterol. This is because a diet that is high in saturated fat raises the LDL cholesterol and lowers the HDL cholesterol. In general, the more saturated a fat is, the harder and more solid it is at room temperature. The main source of saturated fat is animal products, including meat fat, poultry skin, and the fat in dairy products. Butter, cream, ice cream, cheese, whole milk. Plant sources that are high in saturated fat include palm oil and coconut oil. The TLC eating plan recommends that no more than 25% to 35% of the calories consumed each day come from total fat, with less than 7% of calories coming from the saturated fat and with the remaining fat coming from the unsaturated, monounsaturated, and polyunsaturated fat. Refer to Table 21.9 for a summary of the TLC recommendations for daily fat consumption.
Very good, thank you. Okay, Jasmine, can you read soluble fiber?
Soluble fiber in particular has been shown to lower cholesterol level by keeping the cholesterol consumed in food from being absorbed through the intestinal wall and into the body. Examples of foods high in soluble fiber include oatmeal, oat bran, barley, some fruits, apples and oranges, broccoli, and legumes.
Legumes, yeah, that one's kind of a hard
Legumes?
word.
Okay. The TLC eating plan recommends that an individual consume 20 to 30 grams of dietary fiber each day, with 10 to 25 grams of that amount consisting of soluble fiber.
Go ahead and read the next paragraph for me.
Okay. In general, the cholesterol level begins to decrease 2 to 3 weeks after a cholesterol-lowering diet and other cholesterol-lowering measures, such as exercise and weight loss, are begun. Over time, it is possible to reduce the total cholesterol level by 30 to 55 mg/dl or even more through these lifestyle changes. If the blood cholesterol level cannot be lowered to an acceptable level, the provider may prescribe cholesterol-lowering medications along with continuation of the aforementioned measures.
All right, very good. So in generally, you're going to notice that when your provider puts a patient on, let's say, a low cholesterol, lower calorie diet, and we're treating it for purposes of blood pressure and cholesterol, okay? You're going to find that you're going to probably see your patient every 3 months, especially for the cholesterol side, and they're going to want to do lab work every 3 months, because generally if a patient is wanting, let's say they just want to try the diet alone before we introduce medications, it takes the body a good 3 months to be able to see the effects of the changes that the patient's making, okay? All right, hypertension. Hypertension is the most common life-threatening disease among Americans. It is estimated that 68 million Americans aged 18 and older, 1 in 3 adults, have high blood pressure. Another 70 million Americans have blood pressure with pre-hypertension range. All right, and guys, what is a pre-hypertension range?
I want to say that it's close to having. I mean, you're not actually at hypertension yet, but you're
Okay.
almost there.
So what do those numbers look like?
Isn't it 120 to 80?
That 120, so it would be, would it be 120 over 80, or would it be on the other side of
120/60?
excuse me. Yes. So that's right. So both of you are correct. So, and that's where it's also going to be a kind of your provider thing, right? But for our guidelines, pretty much anything over 120 over 80 can be considered your pre-hypertension, right? Because normal is 120 over 80 and, kind of close to those numbers. Now, your provider may go off a different scale, right? Remember when I talked in a few chapters ago that it used to be that borderline pre-hypertension was 130 over 80 or 130 over 90, right? So anything under those numbers, you were okay. Anything over those numbers, you're like, you're getting a little too close for comfort. Some providers still use those range, and some providers will use the range that we go by now. That may be just up to your provider. That's right. Yeah. So pretty much anything. So your top number, which is known as our what? Is it diastolic or systolic?
That's with the S.
All right. So systolic is our top number. Anything over 120, we probably want to just make sure we keep monitoring. Okay. And our bottom number is called what?
Diastolic.
Yep, D for down. That's right. So anything over 80, we're going to kind of monitor that too. Okay. All right. Any questions on that?
Nope.
Okay. So on hypertension, I want you guys on that second paragraph, highlight where it says the damage can result in heart attack or heart failure, stroke, kidney damage, or damaged vision.
I have a question.
Yes, ma'am.
So would diabetics have more a chance to have a high blood pressure, or is that like two different things that don't tie together at all?
Well, yes, in both cases, but so it's two different things, but a lot of times you'll find that some of your diabetic patients do struggle with high blood pressure. And a lot of that could be because their insulin, their sugars are just, they're not under control. Good. But it is two separate things, but a lot of times you'll see that some patients do have both.
I want to say that diabetes, diabetic people also struggle with the cholesterol, right?
Yep.
That's like more of a common thing.
It is. Same thing with high blood pressure. You'll
Yeah.
see a lot of patients, if they're getting treated for high blood pressure, they're probably also getting treated for high cholesterol. Because you'll find that some of the symptoms of the cholesterol being high, like if our levels of blood cholesterol are high, right, that's putting pressure on our arteries. Well, if we have a lot of pressure going on our arteries, what do we think it's going to do to our blood pressure? It's going to be elevated. So another thing that may go hand in hand. So you kind of have to watch on both of those. All right, nutrition therapy. Jasmine, go ahead and read DASH eating plan, please.
Hypertension can be prevented and controlled by following the dietary approaches to stop hypertension. Eating plan. Studies performed by the National Heart, Lung, and Blood Institute show that individuals with normal blood pressure who follow the DASH eating plan can lower their systolic pressure by 6 millimeters Hg and their diastolic pressure by 3 sorry. Furthermore, prehypertensive and hypertensive patients following the DASH plan can actually lower their systolic pressure by 11 millimeters and their diastolic pressure by 6.
Very good. Okay, so highlight that first sentence. All right, Nancy, go ahead and read DASH recommendations, please.
The DASH eating plan is a lifelong approach to healthy eating that is recommended not only for individuals who have hypertension or prehypertension, but for all the individuals. The DASH plan consists of a balanced diet that is low in saturated fat, total fat, cholesterol, and sodium. The DASH plan focuses on fruits, vegetables, whole grains, legumes, and low fat dairy products. In addition to lowering blood pressure, the DASH eating plan can help prevent the development of some conditions such as obesity, osteoporosis, diabetes, cancer, heart disease, and stroke. The comprehensive DASH diet plan is available.
You
Well,
don't have to read the website.
there you go.
Yeah, that's fine. All right, very good. Natalie, please read sodium intake.
A small amount of sodium is needed in the diet. However, most Americans consume too much sodium. It is particularly important for individuals with hypertension to limit the amount of sodium in their diet, which assists in lowering blood pressure. The relationship between sodium and water can be summarized as follows. Where sodium goes, water follows. Because of the plasma of the blood consists primarily of water, a decrease in sodium in the diet causes a decrease in the blood volume. When the blood volume is reduced, there is less resistance or force of the blood against artery walls. Less resistance translates into a lowered blood pressure. Refer to box 21.3 for a list of foods that are high and low in sodium content.
Very good, thank you. All right, so let's go ahead and quickly take a look at box 21.3, sodium content of food. I want you ladies to highlight the second and third bullet point and the last bullet point above low sodium foods.
You said first, second, and third on the top.
The second and third, and then the last one on the top for high sodium foods.
Okay.
All right, Jasmine, can you please read diabetes?
Yes, ma'am. Diabetes is a lifelong condition that occurs when the body is not able to use glucose for energy because of a problem with insulin. Diabetes develops when the body produces little or no insulin, or when the body cannot use the insulin it does produce effectively, known as insulin resistance. According to the American Diabetes Association, almost 26 million Americans have diabetes. Of these, nearly 7 million are not yet diagnosed and are unaware that they have diabetes. An additional 79 million people have prediabetes. Prediabetes is a condition in which the glucose levels of an individual are higher than normal but not high enough to be classified as diabetes. An individual with prediabetes has an increased risk of developing type 2 diabetes.
Very good. All right, Nancy, go ahead and read type 1 diabetes and the nutrition therapy.
Type 1 diabetes is caused by an autoimmune defect that destroys the insulin producing cells or beta cells of the pancreas. As a result, the body can no longer produce insulin and therefore it must be administered by injection. Refer to Chapter 19 for a more in depth discussion of type 1 diabetes. Nutrition therapy. The nutrition therapy for type 1 diabetes focuses on maintaining good control of the blood glucose level. This is accomplished by keeping track of the amount and type of the carbohydrate consumed and when time of day the carbohydrate is consumed. Nutrition therapy for controlling a patient's blood glucose level includes the following methods: exchanging lists, carbohydrates counting, and my plate. These methods are described here.
Very good. Okay, so under type 1 diabetes, I want you guys to highlight the first and second sentence and highlight the first sentence for nutrition therapy. All right, Natalie, go ahead and read exchange list symptom. I'm sorry, system. Goodness.
The exchange list system categorizes food into 6 groups according to their carbohydrate, protein, and fat content. The 6 food groups include starch, fruits, vegetables, meat, milk, and fat. Each food group lists examples of specifically portion foods belonging to that group. An example of an exchange list for fruits is illustrated in figure 21.13. The term exchange is actually the same as food serving. Each exchange or serving has a known or predictable blood glucose response. Any food within a given food group can be exchanged for another one in the group. For example, in the fruit group, a small orange is equivalent to or can be exchanged with 1 small banana, referred to figure 21.13. Because of this, patients following the exchange system must become familiar with food serving sizes. The patient is provided with an individualized plan that specifies the number and type of exchanges that should be included for both meals and snacks. The exchange method provides a balanced and portion-controlled nutrition plan that assists in nourishing the individual while controlling his or her blood glucose level.
Very good. Thank you. All right. Jasmine, can you go ahead and read the carbohydrate counting method?
The carbohydrate counting method offers more flexibility in meal planning than the exchange method. With this method, the carbohydrate content of a food measured in grams is balanced against the amount of insulin administered. Typically, 1 unit of insulin helps to process and metabolize 15 grams of carbohydrate. To balance the amount of insulin administered, women usually need to consume 45 to 60 grams of carbohydrate at each meal, and men need 60 to 75 grams at each meal. Individuals following the carbohydrate counting method must determine the carbohydrate content in grams of all of the foods they consume. This information can be obtained by referring to the data provided in the diabetic exchange list or by referring to food labels and noting the total carbohydrate content of each food item consumed.
Very good. All right, Nancy, go ahead and read my plate method.
The MyPlate method discussed in earlier in this chapter is the most basic dietary approach for controlling blood glucose, referred to figure 21.9. It is ideal for the patient who has a low literacy skills or may be mentally challenged. Patients are taught to visually divide their dinner plate in half. Fruits and vegetables should occupy 50% of the plate. The remaining 50% of the plate is then divided into 2 parts, one for the protein group and the other for the starchy food gains. Starchy foods produce a high blood glucose response and include grain-based foods such as pasta, rice, and bread. Starchy vegetables such as corn, peas, potatoes, winter squash, and lima beans are also included under classification. By limiting the intake of starchy foods to 1/4 of the plate, the individual can control the blood glucose level.
All right, very good. Natalie, will you go ahead and read, let's see, type 2 diabetes?
Type 2 diabetes can affect people at any age by the chance of developing it increases with age, and it is more likely to occur in individuals who are 40 years of age or older. The biggest risk factor for developing type 2 diabetes is excess body weight. As a result of the recent increase in childhood obesity combined with sedentary lifestyle, type 2 diabetes is starting to appear in younger age groups. Individuals with type 2 diabetes may not produce enough insulin, or they may have a condition known as insulin resistance. Insulin resistance is a condition in which the body produces insulin but does not use it effectively. Normally, when the blood glucose level rises in the body, the pancreas releases insulin. The insulin binds to the surface of the cells at a special receptor similar to a lock and key system. The cell recognizes the insulin and opens up so that the glucose in the blood can flow into the cell and can be converted to energy. Obesity can interfere with this lock and key system, causing the cell to become insensitive or resistant to the presence of insulin. When this occurs, the pancreas produces more insulin in an attempt to lower the blood glucose level. Over time, the pancreas is unable to keep up with the increased demand for insulin. Without enough insulin, the blood glucose level rises above normal, resulting in hyperglycemia, glycemia, something like that.
Glycemia. Yeah, that's okay. Hyperglycemia. Okay. So on page 763, I want you ladies to highlight where it says the biggest risk factor for developing type 2 diabetes is excess body weight. And on page 764, highlight individuals with type 2 diabetes may not produce enough insulin, or they may have a condition known as insulin resistant. Also highlight that insulin resistant is a condition in which the body produces insulin but does not use it effectively. All right. Jasmine, go ahead and read nutrition therapy, please. Hey, Nancy, can you please read nutrition therapy?
Sure. Weight management and carbohydrate control are the key for the dietary management of type 2 diabetes. Individuals with type 2 diabetes should consume well-balanced snacks that provide an even distribution of carbohydrates throughout the day. These individuals can also maintain good blood glucose levels by controlling protein size, limiting concentrated sweets, emphasizing low glycemic index foods, and increasing the amount of soluble fiber in the diet. Soluble fibers slow down the absorption of glucose, which helps in controlling blood glucose levels. Do you want me to keep going?
Yes, please.
Another very important aspect of the blood glucose management in individuals with type 2 diabetes is attaining a healthy body weight through caloric restriction and daily exercise. Lowering the caloric intake by 500 kcal each day usually results in a weight loss of about 1 pound a week. Caloric restriction should not fall lower than 1200 kcal a day, however, to ensure an adequate intake of nutrients.
Very good. All right, Natalie, go ahead and read the first and second paragraph for lactose intolerance.
Lactose intolerance is not a food allergy, but rather a condition in which the body is unable to fully digest lactose. Lactose milk sugar is a disaccharide that consists of two sugar units and is found in milk and milk products. Lactose intolerance is caused by a deficiency of lactase, which is an enzyme produced by the lining of the small intestine. Lactase is needed to break down lactose into glucose and galactose, which are then absorbed into the bloodstream for use by the body. When the small intestine does not produce enough of the lactase enzyme, lactose is unable to be broken down and moves throughout the intestines in an undigested form. When this undigested lactose reaches the large intestine, it is broken down and is used as a food source by bacteria normally found in the large intestine. The byproducts that result from this breakdown include copious amounts of gas that cause the symptoms of lactose intolerance.
All right, very good. Thank you. Okay, so you're just going to highlight the first sentence in the first paragraph. All right, Jasmine, go ahead and read the next two paragraphs, please.
Lactose intolerance usually begins during late adolescence or adulthood. This is because the amount of lactose produced by the body gradually declines after childhood. Lactose intolerance can also be caused by intestinal disease or injury. Lactose intolerance is most common in individuals of Asian, African American, and Hispanic descent, and much less common in individuals of European descent. The symptoms of lactose intolerance vary based on the amount of lactose an individual can tolerate. Some individuals may be able to tolerate only very small amounts of of lactose before they begin experiencing symptoms, whereas others may be able to consume larger amounts of lactose before experiencing the symptoms. The symptoms of lactose intolerant can range from mild to severe and usually begin 30 minutes to 2 hours after consumption of foods containing lactose. Common signs and symptoms. Oh, sorry.
No, it's okay. Go
You
ahead.
want to keep going? Okay. Symptoms of lactose intolerant include the following: abdominal bloating and cramping, flatulence, diarrhea, for
Flatulence.
flatulence, diarrhea, and what's that? Bor
Borborygmi.
borborygmi, gurgling or rumbling sounds in the abdomen, and nausea.
All right, very good. All right, does anybody know what flatulence means?
No.
No.
All right. Nancy, go ahead and look that up for me.
I have a question.
Yes, ma'am.
So, can someone be lactose and go so long without knowing that they are?
Yes. Yeah. Because sometimes the symptoms aren't so bad to where you'll notice that could be the problem. And not everybody has all the symptoms. So, and then it could be that your sensitivity, the more you do it, the more of a bothersome symptom you're going to have. Yes, Alexis, that's right.
Suffering from accumulation of gas in the alimentary canal.
That's right. So flatulence basically means we've got gas. All right. So
It's
I
just
want
a
you guys to
fancy word.
go ahead. What was that?
I said it's just a fancy word.
Yeah. Yeah.
More
It's your
professional.
medical term word.
Yeah.
All right. So highlight each of the common signs and symptoms. Very good. So there's also points into where you may notice that your child, let's say when your child is born, the pediatrician says that they're lactose intolerant. Okay, so you got to change formula or change the milk, whatnot. They can also grow out of it. Okay, which means they're not as sensitive to lactose as they were when they were itty bitty. So that is it's a normal symptom. I wouldn't say as far as it's like you're lactose intolerant, but you could be really sensitive to it. Now, I will tell you that even for Amy, when she was younger, when she was like, oh God, I don't know, 1, she became lactose intolerant. So we actually did get where this says lactate in figure 21.15. That's actually what I used to buy. And she responded well to it. And I didn't know, I couldn't even taste the difference. So we all drank it. And then as she got older, she tolerates, I get reduced or 2% milk. But
So, to find out, do you just like go by the symptoms, or is there a way to find out that if you're actually lactose intolerant?
the biggest clue is going to be the symptoms you have from it. Because even if you go to your provider and you're like, okay, so every time I have a bowl of cereal, my stomach gets really cramping and it hurts and there's all these gurgling sounds, and he's going to tell you that it's the lactose. So it's usually based off of just by your symptoms. Now, if they get too severe, then yes, you may have to have some tests done. But the one thing that they may have you do is switch to a lactose-free milk. No, it's not the same, because the milk that they use in ice cream may be different than the milk that you buy. So like let's say that you buy 2% milk for your cereal, but maybe your ice cream is made with whole milk. the whole milk, it may be, that may be a little bit, it may be a little different. No, it may not necessarily be the same. All right, nutrition therapy. We get almond milk. I guess it's not 2%. I didn't know that. Yeah. Almond milk, some people do respond better to almond milk or soy milk. You know, everybody's a little different. But I'm not too familiar with almond milk to know how it comes. Soy milk, you can get it in different ones. I'm not sure about almond milk. How do you feel after you do the almond milk? Yeah. So it could just be in the difference in milk. All right, very good. Nancy, can you read nutrition therapy?
Lactose intolerance is treated by limiting or avoiding foods containing lactose such as milk and milk products. Figure 2114. Consuming a food containing lactose with a meal instead of by itself may help prevent or reduce symptoms. Other forms of treatment include consuming lactose-free dairy products, figure 21.15, and substituting rice milk, soy milk, and soy cheese for milk and milk products. Cultured milk products such as yogurt contain bacteria that produce the enzymes for breaking down lactose. A lactose intolerant individual can usually consume these products without triggering symptoms. Over the counter lactase enzymes supplements are also available. Dairy yeast capsules, lactate chewables that assist in digesting lactose. These supplements must be taken before consuming foods that contain lactose. Although there is no cure for lactose intolerance, it is not a serious condition and can be treated effectively through careful dietary planning.
Okay. So on the highlight where it says lactose-free dairy products and substituting rice milk, soy milk, and soy cheese for milk and milk products. Highlight cultured milk products such as yogurt contain bacteria that produce the enzyme for breaking down lactose. Highlight that a lactose intolerant individual can usually consume these products without triggering symptoms. So one thing you can do is if I think that I might be lactose intolerant, you can kind of do like a little trial and error, right? You can try, you know, eating a regular milk product, see how it makes you feel. Eating a lactose-free product, see how it makes you feel. And then just try maybe taking something before you consume lactose and see how you feel. Now, it's not a serious condition, but it can be an uncomfortable condition, right? Like it can definitely make you feel a little uncomfortable if you're constantly feeling the bloating and the cramping and, you know, you're gassy, your bowel movements are all over the place, you know, your stomach's always going haywire with the noises, you know, so I mean, it can kind of be a nuisance. And no, it's not a serious condition, but it can be very bothersome for patients. All right, very good. Natalie, can you go ahead and read the next paragraph, please?
Consuming milk, we're consuming milk.
Yes.
Consuming milk and milk products provides a convenient way to obtain enough calcium and vitamin D in the diet. Individuals who are lactose intolerant may need to ensure they are obtaining enough of these nutrients. Menu planning. Non-dairy foods that contain calcium include canned fish containing bones, examples salmon, sardines, broccoli, spinach, legumes, and calcium-fortified breads and cereals. Non-dairy foods that contain vitamin D include fish liver oil, liver, and fortified cereals. The body also manufactures vitamin D when it is exposed to the ultraviolet rays of the sun.
All right, very good. All right, so gluten intolerance. Gluten intolerance is a condition in which an individual cannot tolerate the ingestion of a substance known as gluten. Gluten consists of protein found in certain grains such as wheat, rye, barley, or triticale, a cross between wheat and rye. Gluten intolerance most commonly occurs with celiac disease and non-celiac gluten sensitivity, NCGS, which are discussed in more detail in the following sections. Highlight that gluten consists of a protein found in certain grains such as wheat, rye, barley, and triticale. Celiac disease. Celiac disease is an autoimmune disorder of the digestive tract in which the immune system launches an attack system against gluten. Highlight the ingestion of gluten irritates the small intestine, which causes damage to the villi. Villi are finger-like extensions that line the small intestine and increase its surface area, providing an increased absorption of nutrients into the bloodstream. Damage to the villi results in a decreased surface area for absorption, which leads to malabsorption of nutrients. Non-celiac gluten sensitivity, NCGS, is also a disorder in which the body cannot tolerate gluten. Unlike celiac disease, however, NCGS does not cause damage to the villi of the small intestine. Before a diagnosis of NCGS is made, the patient is first tested for celiac disease to rule out that condition. Research estimates that approximately 18 million individuals in the United States have NCGS, which is 6 times the number of individuals with celiac disease. All right, symptoms of gluten intolerance. Celiac disease and NCGS share many of the same symptoms. However, the symptoms of NCGS are usually less severe. Symptoms of gluten intolerance tend to vary widely among patients following: abdominal bloating, abdominal pain, weight loss, flatulence, diarrhea, constipation, foul-smelling stools, headache, fatigue, joint pain, brain fog, and depression. Okay, Alexis, I'm not going to say for certain, but I think if she has a severe allergy to gluten, maybe. I would actually have to ask the doctor on that one. I'm not sure. I mean, because when you're dealing with, let's say if I'm making pizza dough and I'm going to do, we're using wheat flour. If I'm doing that a lot, the flour is probably the fumes, the dust, a little bit of the flour probably going into my nasal cavity, right? Which in turns goes through the body. So maybe, if there's a severe allergy, I would think so. But I don't know for certain. I'd have to ask a provider on that one. All right, nutrition therapy. The treatment for gluten intolerance is to follow a gluten-free diet, which is hard. I had to do that. Which consumption of
Everyone else there?
I hear her.
She's the only one that's gone, right?
Yeah.
Internet is out.
Says she's still there.
I mean, her internet is out, sis. I mean, her internet must be slow.
Oh, here she goes.
Hi,
Can
Miss
you hear me?
Danielle. We can hear you
Hey,
now.
Yes.
did I lose you?
Yes, you did.
Yes.
Oh, I'm sorry. I was just talking away. What did y'all
Yeah.
last hear?
You'll have to start over because as soon as you started, it went out.
Okay, what did y'all last hear?
Nutrition therapy?
Did I didn't finish that?
We didn't even hear you started. We just nutrition therapy.
Well, poot. Okay. The treatment for gluten intolerance is to follow a gluten-free diet, which excludes the consumption of all foods containing wheat, barley, rye, and triticale. Foods that frequently contain gluten include bread, cereal, crackers, pasta, salad dressing, baked goods, soups, sauces, and beer. Foods that are gluten-free include beans, seeds, nuts, eggs, meat, poultry, fish, seafood, fruits, vegetables, and dairy products. Grains that are gluten-free include buckwheat, cornmeal, flax, quinoa, rice, soy, and gluten-free oats. There are also many gluten-free food products available that can be used as alternatives to foods that contain gluten. So gluten, I don't know. I know that at some point I did develop a sensitivity to gluten and I had to do the gluten-free diet. That was actually really difficult because when I first had to do it, there wasn't many gluten-free options. Like I had to learn how to completely cook different. It was crazy. Going out to eat was hard because I mean, I can't order a hamburger. I mean, I could just not eat the bun. But it was hard. It was a big adjustment. So I give props to anybody that has to do a gluten-free diet. All right, any questions on that, ladies? No, can y'all still hear me?
No question.
Okay. All right. Food allergies. Alexis, are you where you can read food allergies?
Yes. Yes.
Thank you.
Can you hear me?
Yes.
In the United States, food allergies affect approximately 6% to 8% of young children and about 4% of common food allergies include milk, wheat, peanuts, soybeans, peanuts, cashews, walnuts, hazelnuts, almonds. Food allergies may also be triggered by strawberries, tomatoes. It is important to recognize the signs and symptoms that proper treatment. Symptoms of food allergy hours after ingestion of skin and respiratory of GI system are often common symptoms: skin rash, hives. In addition, swelling and itching of the tongue, ears, eyelids, pain, shortness of breath, GI symptoms, abdominal pain, nausea, vomiting, and diarrhea.
Okay, very good. So on food allergies, I want you to highlight that common food allergies include milk, eggs, wheat, fish and shellfish, peanuts, soybeans, and tree nuts. And also highlight that common symptoms include skin rash, hives, and swelling. In addition, swelling and itching of the face, tongue, ears, eyelids, and lips may occur. So have any of you heard that after you have a baby, like it's dangerous to give them eggs, strawberries, tomatoes until they're of the age of 2? Has anybody heard that?
Fish is one, right?
Yeah. Yeah, it's because it's such a common allergy that if we give the kids these products too soon, we're only asking them to possibly become allergic. Okay? So it's very important that if someone has a food allergy, even as a medical assistant side, you document it. Like if I say I have a shellfish allergy, I'm going to document that because occasionally some over-the-counter products and some medications may have shellfish or may be produced in the same facility of something else that I'm allergic to. So it's really important that all allergies get documented.
Can I share something with you?
Yes.
So one time, a long time ago, when I was doing my extern, sometimes your doctors, depending on, I don't know what it is, maybe they're not that busy and just want to do something, but sometimes they don't necessarily come to you and say, hey, can this patient's going to need this and this. I don't know. Deal is the doctor decided to give the patient I think it was flu, the flu shot. I don't remember if it was the mist or the actual shot, but the doctor decided to do it. And when the doctor she handed me the file, she's like, "Oh, I wrote on there the flu shot." She's like, "It's all been documented. Don't worry about it. I already gave it to the patient." And I looked at her and I said, "She's allergic to eggs, though." And her face, I mean, it was just like she didn't realize it.
Yep. That's a big one. And that's a big, big, big common reason why we also document it, because even some vaccines, if a patient has an allergy, they can't get it.
Correct.
Yep. So yeah, I believe it. It has happened. All right. Nutrition therapy. Food allergies are most commonly treated with special diets. The response of the body to a food allergen can range from mild to moderate to severe. The specific treatment recommended depends in large part on the severity of the allergy. Common methods of treatment for food allergies are as follows. Yes, document, 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 document. Thank you. Elimination diets. An elimination diet involves removing the offending food from the diet and is typically recommended when an individual is allergic to one or two foods. Removing the offended foods from the diet is an easy way to prevent an allergic reaction. Highlight that an elimination diet is also necessary when an individual has a severe allergy to food, for example, peanuts. That might result in an anaphylactic reaction if the food is consumed. Food allergies are typically more severe earlier in life and tend to diminish in intensity as aging occurs. Reintroduction of that food allergen should be conducted only under a provider's guidance. We also do that, yeah, and so that's a good point, Nancy. So Nancy said that it was documented, however, she said that the doctor didn't read the chart. So as a medical assistant, it is really important that we are our advocate for our doctor, right? Because doctors, not that they just don't look at it, but they're really busy, right? So we need to be able to be the advocate for our patient and for the doctor. So as a medical assistant, we do read the patient's chart all the time. We're in it every day. So if you see that, I'm going to go ahead and, hey, Dr. So-and-so, she does have an allergy to eggs. Or I'm going to go and point it out. I may not say it out loud. I may point it out on the patient's chart, and I make sure that the doctor sees what I'm pointing out. So just kind of a tip that you may want to do with your provider. So one thing with the elimination diet that we also do is we actually do the same method for medication, right? Let's say that our provider prescribed a patient a hypertension pill. Patient's been on it for a few months. All of a sudden, we're noticing some redness and swelling on the lower extremities, okay? And we really think that it's an allergy to something. So we go through the diet. We go through topicals. We also go through oral medications. The one way to figure out what it is that you stop having the patient take that medicine for a period of time, and then slowly have the patient introduce that medication again after everything clears up. And usually within just a couple of days, you'll start seeing the symptoms again. And you're like, oh, that's it. So you introduce one thing at a time, because if you have the patient either eat or take multiple, you're not going to know what the allergy is. It's really hard to find out. All right, rotation diet. An allergic response to a food often increases when a food is repeatedly consumed. Highlight a rotation diet. Use of a rotation schedule limits the number of times a food is ingested. Highlight this typically leads to a gradual desensitization to the food allergen, which lowers the allergic response to that food. A rotation diet is usually recommended for mild to moderate food allergies. The most commonly used food rotation interval is 4 to 5 days. This means that the problem food, as well as foods belonging to the same food family, is consumed only every 4 to 5 days. A rotation schedule not only allows for the consumption of a known food allergen on a rotation basis, but may also minimize the development of a new food allergy. Denaturation. Exposing a food to heat will denature or alter the chemical structure of the food allergen protein so that the body no longer recognizes it as an invader. A child who has an is allergic to milk may be able to tolerate milk if it is heated in hot chocolate because of the denaturing process. An individual's tolerance to cooked and canned fruits and vegetables is typically much better than to fresh fruits and vegetables. Exposing the food allergen to acid has the same result. For an example, adding tomato or lemon juice to a food allergen may significantly reduce the allergic response. All right, medication and supplements. Medications that suppress the allergic response may be prescribed to treat the food allergy. Because such medications treat only the symptoms and not the cause of the allergy, the food allergy may actually become worse over time. The oral intake of supplemental digestive enzymes can assist in treating food allergies. Highlight digestive enzymes help break down the food into smaller, less allergic molecules. This, in turn, decreases the allergenic response of the body. With continued intake, however, the individual may actually become allergic to the enzymes themselves. Antacids that contain bicarbonate are used to treat food reactions. The pH of the blood becomes acidic during an allergic reaction. Bicarbonate antacids cause the blood to become more alkaline, which works to neutralize the acid pH and helps to relieve the allergic symptoms. There are several vitamins that assist in controlling food allergies. They include vitamin C and vitamin B5, pantothenic acid. Vitamin C exerts a stabilizing effect on mast cells, resulting in a reduction in the amount of histamine released by the body. Vitamin B5 functions in steroidal hormone production, which can lower the allergic response. Both of these vitamins are water soluble and therefore can be administered as a supplement without danger of toxicity or overdose. All right, guys, that is the end of